Hello. In this video, I'll be talking about clinical trials. What is a clinical trial? Should you consider participating in one? What are some of the advantages and disadvantages of a clinical trial? Clinical trials are studies with people who usually have a disease, and what we're trying to do is always improve. So a lot of the treatments that are already offered to people with cancer, including breast cancer, have been studied, and we've learned that they work because people participate in clinical trials, or clinical studies is actually easier to talk about. It's important to know that in clinical trials or studies that you're not going to be receiving no treatment. In other words, even the standard of care is good treatment already, and this is, if you participate in a study, a chance to get something better than the best we already have, if you will. Clinical trials in breast cancer usually enroll hundreds to thousands of people, and you have to have certain criteria. There have to be certain things about you and the cancer that's being treated to decide whether that trial is right for you. Now, because it takes so many people in a study, and because there are 2 or even 3 or 4 groups of people, it can take a long time for us to get the results of the study. So you may participate in a clinical study, and I'll give you some examples in a moment, and not actually find out, did you get the better treatment than standard, or was standard just as good? So it can take a long time to find out, and you will be informed of the results of the studies if you're in the type of studies that shares its results. All right, so let's talk about a couple different types of people who might participate in a clinical study. One is a patient, for example, who's finished surgery or is going to have treatment before surgery, and what we're doing usually is modifying the chemotherapy or the hormonal therapy or the targeted therapy. You can see our other videos about each of those types of treatment. And you can also learn more about your tumor and your disease treatment options at Yerbba.com if you want to get your own report. But back to the studies, we study treatments for breast cancer from prevention all the way up to symptom management in people living with advanced disease. And we're always trying to improve, sometimes by a couple percentage points, but if you do that for enough studies, this is where you see the marked improvements in survival and improvements in quality of life in people being treated for breast cancer. Now, I mentioned before that you're going to get some form of treatment. What I mean by that is, let's say treatment A is already known to be the best treatment. Let's say we want to improve the treatment a little bit more. We might take the best treatment and add something. Or we might say, maybe that's too much treatment. Can we give this treatment, treatment A, and compare it to a little less? Now, all studies go through an ethics procedure review, scientific review. We make sure that neither group in the study is going to get something that increases the risk of a bad outcome. Generally, these are just little tweaks to treatments that are already standard. Sometimes, though, it's a big change. Like when we started studying trastuzumab or Herceptin, that was a big change in treatment. So let's recap. Generally, clinical studies are done to give people the chance to get something better than the best we already have. That might be better survival, better remission rate, fewer symptoms, and you will get, most likely, standard treatment or be randomly assigned to get the newer treatment. That's not a choice you or your doctor or your nurse or your friends can make unless they tell you that there's a choice of treatment. In general, this has to be random. These are called randomized clinical trials, or RCTs, you might see them called. So you've heard a little bit about how clinical studies or clinical trials work. Why would you want to participate? Well, again, it's a chance to get something better than the best we already have. The second thing is it can be the only way to get a novel treatment. So when we make a discovery that works in phase 1 studies. These are studies where we're using the medication in a very small sample of people, or sometimes we'll do what are called first-in-human studies. Before we can roll these out and make them the standard of care, we have to do a clinical study. And sometimes that's the only way to get the novel treatment. What if you get randomized to the standard of care? Well, that's what you would have gotten if you didn't go on the clinical study, right? So if you participate in the clinical study, there might be a 50% chance or 2/3 chance that you're going to get the new therapy. Plus, we don't even know if it's better. So we have something called equipoise. And that means that they're equal when we go into a study. I do it like this, equipoise. We don't know, it's a shrug. So that's why we have to do the studies, to make sure that this novel therapy that might work in animals or in one clinical setting or another cancer is going to work in breast cancer. So 2 reasons to go on. It's the way to get a treatment. The other reason is actually because you are contributing to the care of other people with breast cancer, to your metaphorical daughters, if you will, or sisters, or friends. And remember, everything we offer today we know works because other people participated in clinical trials. And a lot of people I work with, they like the idea that they're pushing the field forward. They're paying it forward, if you will. Another key thing to know, and this is sort of an aside, is if the study is not going well, you're not feeling good, you come first, not the clinical study. So let's say you have a side effect that you can't tolerate, that we can't control, you come off the study. You've done your part, thank you so much, but we have to put you first. The other reason some people participate is because it's a way to have some of the costs of treatment covered. Now, we can't ethically say, go on this treatment or you won't be able to get treated, but it can be an advantage. Now, it's also important to know that some of the costs of clinical trials, like transportation and other trips for blood work or doctor visits, may not be covered by the study and may get billed to your insurance company, which means you have copays. So it's really important to ask the person talking with you about the study, what are the costs of treatment? And we will help you figure those out and do everything we can to reduce the burden. We can't reduce the burden of your time, and we are so grateful to the people who participate in clinical studies. I have to say, at our annual meetings, whenever somebody presents the result of a new study, they always thank the patients and their families who participated. Now, in people with advanced disease, either it's spread through the body or it's not removable by surgery, being on a clinical trial can be a way for you to get something new when other things have stopped working. So it's important to know that while we can't say you'll be cured, and we can't even say the treatment will work, that a lot of times we'll offer a clinical study to somebody in whom other treatment options are no longer working, but the patient overall feels really good. So she wants to keep trying to be on treatment, and we can say, well, we have this clinical trial that you might be eligible for. So that's another reason to participate if you have advanced disease or a very unusual cancer. So I use the word eligible. What does that mean? So clinical trials try to get a very homogeneous population of people who are generally fit, feeling pretty good, whose cancers tend to be very similar. So when we talk about eligibility for a trial, we have a checklist we go through, and we'll go through that with you and show you why that study's right for you or not. But in general, there are a certain number of treatments that you can have had before, or perhaps the trial is for somebody being treated with curative intent. Usually you can't have had chemotherapy for another cancer. We also need to make sure you're generally quite fit. We don't want to treat people who are quite ill. Treatment with chemotherapy or other anti-cancer therapy may not be the right thing if you're very sick. Really what we should do is get you feeling better before we treat the cancer itself. In other words, treat the person and the symptoms, and then get them feeling good enough to then be on a new anti-cancer treatment. So those are some of the things we look at. What other treatments have you had? Your general level of health. We'll also look at whether or not we can see the disease. Is it measurable? So for people with advanced disease, generally we have to be able to see the cancer. So tumor markers being elevated, it does not make somebody eligible for a clinical study. The other things we look at are your kidney function, your liver function, and are you able to understand the consent form? So let's say you are the caregiver for a family member who is not cognitively able to consent. Generally, trials are not right for somebody who can't make an informed decision. So now I just talked about informed consent. That's the next thing we should talk about. The informed consent document is a document that ethically provides you with all the information about the advantages, disadvantages of being in the study, and if you don't go on the study, what treatments are available to you. The key thing is that this is a teaching document. This is sometimes 30 pages, and it's really hard to understand all of the things in the document. So before you sign a consent form, it is your right, and actually it's your responsibility to understand the study you're participating in. If you don't understand, please ask questions. There's nothing more important to me as an oncologist than to make sure I've done my part in helping you feel you are making an informed decision. Now, can we tell you absolutely everything that might happen to you on the study? No, we don't always know. These are new drugs, new treatments, new combinations, new schedules, so we don't always know. But everything we get up to the point of that clinical study, we will share with you, everything we know. And we'll also help you understand what things are likely to happen, less likely to happen, and very unlikely to happen. And as part of a clinical study, you will have all of your symptoms that arise monitored very closely and managed very effectively. You and your team will work together to make sure you feel as good as possible. Next, I'm going to talk about the downsides of being in a clinical trial. It's really important to know that we don't know going into the study which of the treatment groups is better, or if it's just one group, if that's better than what we already have. You are participating in the research enterprise. You're helping us ask and answer that question. So it's really important you understand the question we're asking and what the benefit is to you. For a lot of clinical studies, we can't tell you there's any benefit, right? Because we don't know if group A or group B or C or D is better than what you would get off the study. So we can't tell you, but we don't know, and a lot of people say, I went into the study to get the best treatment. We wouldn't be doing a study if we knew it was the best treatment. The second thing is, sometimes people sign the informed consent document without understanding. They feel pressured because they want to get started on treatment. Or let's say the doctor's like me, really enthusiastic about the study. It's really important to take a pause, make sure this is right for you. Just because the doctor's excited about it does not mean you need to be excited about it. It may be too much. It can be too much information. And sometimes it's just not the right thing for you. And you are more important than anything else, more important than making your doctor happy, your partner happy, your friends, family, kids happy. It's really important this feels right in your gut. So I hope that you understand that the downside would be you do something that isn't right for your gut, and the upside is you do something that is. So after all this, you're interested in knowing, is there a clinical trial for me? I want to be part of this. I want to have a chance to get something better than the best we already have. How do you know if there's a clinical trial? Well, the best thing to do is to ask your doctor. Now, it's possible there won't be a clinical trial at your doctor's office, and your doctor may say, we don't have any trials here, but I know of a place that does. Now you have to decide, is it worth going to a different place to be on the trial, or do you just want to stay with your doctor because you're already getting good care? So sometimes this might mean travel or meeting a doctor for a new time. That can be a bit of a hassle. So your doctor will tell you whether or not they have a trial in their practice. You can always say, do you know of any other trials nearby or even somewhere else in another city or state? And the other place to look is a website called clinicaltrials.gov. Now, this webpage is not particularly patient-friendly, but if you have somebody navigate it with you, or you go through it with your doctor, or you start the search, you can actually find a trial that looks like it might work for you. You can call that site and tell them you're interested. You can be in charge of this as well, and they'll ask you a few questions, and that will help you decide. So, a lot of information. I've covered a lot here. I'm sorry you're going through this, but I know you can get through it. And feel free to watch this video again, because again, I did cover a lot. Don't forget to visit Yerbba.com for your Yerbba report. And if you like this video, click like, and you can subscribe to our channel and see other things that we cover.